Bismillahirrahmanirrahim. So today we are going to study about the carcinoma of esophagus. So carcinoma of esophagus consists of two types: the adenocarcinoma and the squamous cell carcinoma. So today we are going to study about the adenocarcinoma of the esophagus. So adenocarcinoma, it is the malignant proliferations of the glands. It mostly arises from the pre-existent Barrett esophagus. So Barrett esophagus, one of the complications of the Barrett esophagus is the adenocarcinoma. It is also associated with the chronic GERD, obesity, tobacco smoking, and the radiation exposure for any cancers. It mostly involves the lower one-third of the esophagus, in contrast to the squamous cell carcinoma of the esophagus, which usually involves the upper and middle third of the esophagus. It mostly common in the USA. It is the most common esophageal carcinoma in the USA, while in the rest of the world the most common esophageal carcinoma is the squamous cell carcinoma. It is predominantly in the men and at the age of about 4 to 50 years, i.e. 40 to 50 years of age. It is mostly common in the men. Now, what is the pathogenesis of the adenocarcinoma? So it is mostly due to the p53 tumor suppression gene mutation. This mutation will cause the increased proliferations of the cells of the esophagus and will lead to the adenocarcinoma. However, there are also evidence that there is translocation of the beta-catenin gene, and this will in turn lead to the increased proliferations of the esophageal cells. Now, what is the morphology of the adenocarcinoma of the esophagus? So grossly it will appear as flat or raised patches, and it is in the initial stages. It appears as flat or raised patches, while in the later stages it may be exopatic, infiltrative, or ulcerative lesions. It may be exopatic, mean that they are protruding out of the wall of the esophagus into the lumen. Infiltrative, that it infiltrate the wall of the esophagus, and ulcerative mean that it form the ulcer. Microscopically, as we already discussed, that is a tumor of the glands, so we will see a lot of glands. And the adenocarcinoma may show three patterns: intestinal type of the adenocarcinoma of the esophagus. Intestinal type in a sense that it resembles the intestinal the tumors of the gastric and intestine. Adenosquamous type consists of irregular mixture of adenocarcinoma and the squamous cell carcinoma. In adenoid cystic type, it consists of glands in the form of cyst. There are also usually Barrett esophagus adjacent to the tumor, and the tumor shows that there are a lot of mucin and glands. As I have earlier discussed, that it is the tumor of what? It is a tumor of glands. Now, what will be the signs and symptoms of the adenocarcinoma of the esophagus? So the esophageal cancer is characterized by the progressive difficulty in the swelling, loss of weight, fatigue, and the chest pain. Progressive difficulty in the swelling is mostly due to the solid substances, and then progress to the liquids. And by the time the sign and symptom appear, the tumor usually has invaded submucosal lymphatic vessels. And it has very poor prognosis, and the peripheral survival rate is less than 25%, and it is mainly due to the late diagnosis. So let's study about the squamous cell carcinoma. So the squamous cell carcinoma, it is a malignant proliferation of the squamous cells of the esophagus. Most commonly esophageal cancer worldwide, as we already discussed. The most common esophageal cancer in the USA is adenocarcinoma, and worldwide it is squamous cell carcinoma. It is mostly present in the upper and middle third of the esophagus, in contrast to the adenocarcinoma, which is present in the lower third. The major risk factors for the squamous cell carcinoma of the esophagus are the alcohol and tobacco, which are the most common one. Very hot tea, achalasia, which is the inability of the relaxation of the lower esophageal sphincter of the esophagus, esophageal valves like which occurs in the Plummer-Vinson syndrome, esophageal injury due to any chemicals like the ingestion, nutrition deficiencies like the vitamins and the iron supplements which are required for the normal growth of the esophageal mucosa, exposure to polycyclic hydrocarbons, nitrosamines, and other mutagenic compounds like found in the fungus contaminated food. They also cause mutation. It will lead to the squamous cell carcinoma of the esophagus. The human papillomavirus is also one of the vector for causing the for causing the squamous cell carcinoma of the esophagus. Now, what will the morphology of the squamous cell carcinoma? So, morphologically, we can see grossly and microscopically grossly three patterns of the squamous cell carcinoma are recognized. The first one is in the early stages they occur in the form of gray-white plaques. In the later stages it may attain one of the three forms. It may be in the polypoid form, which is the most common type, and it appears as the cauliflower-like mass protruding into the lumen. For example, this is the esophagus, and here it occurs as the cauliflower-like mass in the lumen. Ulcerating type, in which there is necrotic ulcer having everted edges, and the diffuse infiltrating type, which infiltrate into the wall of the esophagus, causing rigidity and thus narrowing of the lumen. Microscopically, majority of the squamous cell carcinoma are well differentiated or moderately differentiated. We can also see prickle cells. What are prickle cells? These are the spinous cells. Spinous cells or the keratin producing cells. You will see a lot of prickle cells, keratin pulse, and the poorly differentiated non-keratinizing and neoplastic patterns of the squamous cell carcinoma can also be seen, in addition to the well differentiated or moderately differentiated. So these were some points regarding the morphology. Here you can also see these. It is the polypoid pungating type of the squamous cell carcinoma protruding to the lumen of the esophagus. Here you can see the ulcerating type having ulcers and the everted margins. These are the everted margins, and here you can see infiltrative type infiltrating into the wall of the esophagus. This is another picture showing the esophagus, in which is the infiltrative type, in which the squamous cell carcinoma infiltrate into the wall of the esophagus, causing thickening of the wall and narrowing of the lumen of the esophagus. Here also you can see neoplastic tumor cells, the squamous walls. These are the keratin pulse, in which the keratinocytic cells are arranged in the form of walls, and also you can see invasion. The signs and symptoms of the esophageal carcinoma of the following: that it is progressive dysphagia from solids to the liquids. There is weight loss, pain, hematemesis, which is blood in the vomit, hoarse-voice, and it is due to the involvement of the recurrent laryngeal nerve and the cup due to the tracheal involvement. These symptoms present late, and this will lead to the poor prognosis of the squamous cell carcinoma. Now, let's talk about the spread of the squamous cell carcinoma, adenocarcinoma. So it may follow one of the three routes. It may spread locally through the lymphatics or through the blood. So local spread to the respiratory tree will cause pneumonia, to the aorta will cause severe bleeding, and to the esophageal wall, mediastinum, and the pericardium will cause the respective symptom. Lymphatic spreads. Location of the lymphatic node spread depends upon the level of the esophagus involved, and the upper 1/3 of esophagus, they usually spread to the cervical lymph nodes. The middle goes to the mediastinal tracheobronchial lymph nodes, and the lower third to the celiac and the gastric lymph nodes. Heterogeneous spread is very rare, but it can occur to the liver, lungs, and the adrenals. So that's all regarding the adenocarcinoma and the squamous cell carcinoma of the esophagus. So thank you.